Yeah, I just put the pack in there.
That's fine.
Oh, there's that thing, that box.
That's the box.
Right there.
That's the little box.
That's what she's putting the saline in.
She whips it.
Don sterile gloves are one sterile glove on the dominant hand
See how
and
it
a clean
spills
glove on a
out?
non-dominant hand.
Non-dominant. Can I repeat that part?
Yeah, okay. Are you right or left-handed? I'll show you.
Dominant hand and a clean glove on a non-dominant hand.
Yeah, I'm just,
So
you
clean.
would have it right over here by you. And we're gonna play like we got. What she's talking about in gloving, remember how I taught y'all? I'm dominant right. So I pick it up right here, step back a little bit, and I slip it on. Don't worry about that. And I'm gonna go up underneath here, making sure I don't contaminate myself. And now I can fix my fingers. Okay. All right, so now I got my
Connect the
gloves on.
sterile suction catheter to the suction tubing held with your unsterile gloved hand.
The dominant is supposed to be the one that you sterile with,
Right,
right?
yeah. So she undoes that.
Moisten the catheter tip by dipping it into the container of the sterile saline.
Now what I don't understand what she
Using a
did.
sterile gloved hand, gently and quickly insert the catheter into the trachea.
We're just
Advance
gonna
about 10 to 12 centimeters or 4 to 5
So we
inches
gotta get
forward
wet.
until the patient coughs. Do not occlude the Y port when inserting the catheter. Apply intermittent suction by occluding the Y port with the thumb of the unsterile gloved hand. Gently rotate the catheter with the thumb and index finger of the sterile gloved hand as the catheter is being withdrawn. Do not allow suctioning to continue for more than 10 seconds. Encourage the patient to cough and deep breathe between suctionings.
Okay, Mr. Jones, if you'll just cough that mucus up, I'll be able to suction it out for you. I'm gonna give you a little bit of time to rest, okay? Catch your breath.
Flush the catheter with saline and repeat the suctioning as needed, and according to the patient's tolerance of the procedure. Allow the patient to rest at least 1 minute between suctioning. Limit suctioning events to 3 times. Also tape the chest to evaluate breath sounds.
Suck it out.
Really good, Mr. Jones. Let me listen
And
to
then
your
you go
breath
back and
sounds to
get
make
some
sure
more
that
stuff.
they're still clear.
Okay.
Or they're clearer than when we
What
started.
I noticed, when she hooked up the end of this to the tubing, it looks like she contaminated her dominant hand.
Yeah, that's what
I
I
don't
was
want to say
wondering.
It
that,
sounds
okay?
much better,
Incredible.
much better.
But if you're gonna do that,
When the procedure is completed, turn off the suction and disconnect the catheter from the suction tubing. Remove the gloves inside out and dispose of the gloves, the catheter, and the container, with
see how
the
she's
solution
widing
in
that
the
up in her
proper
hand?
She
receptacle.
touched it, yeah.
Wash your hands
And
and
then
adjust the
this
patient's
would go
position.
inside the
Record
deal.
the time of suctioning.
So that's
and
what the red
nature of
bag's for. I was like,
concentration.
why does she
Yeah.
need
Also,
that?
should
I'll put
care
that
for
in
the
the red
patient's
bag,
respirations
so
before
what
and
you
after
need to do-
suctioning.
let's just do
Always
this.
offer your patient oral
Okay.
hygiene.
All right, Mr. Jones, that went very well.
So we need this and this. One of this and one of
Okay. So what happens,
But when you use it
On-
as a non-sterile.
okay, on this, the main thing about this suction right here is that, say, about from here on down, gotta have it sterile,
Okay.
okay? But I saw her use this, what I would call her sterile hand, putting this on. So if you can one hand this, which I don't know if you can do it,
Then,
gonna be an art to it.
held with your unsterile gloved hand.
You can do it. but
Okay.
don't contaminate your dominant hand.
Okay.
Because remember, this is going down into your breathing tube,
Right inside.
so you don't want to contaminate your dominant hand.
Okay.
And,
Moisten the catheter tip by dipping it into the container of the sterile
and
saline.
this is not actually on the patient, it was over here. And you moisten the tip.
Using the sterile gloved hand, gently and quickly insert the catheter into the trachea. Advance about 10 to 12 centimeters or 4 to 5 inches, or until the patient coughs. Do not occlude the Y port when inserting the catheter.
The Y port is probably this right here.
Apply
So would you back
suction
up if
by
they
opening
cough?
the
Would you
Y
like?
port with the thumb
Okay, that's
of the
what I thought.
unsterile gloved
And then
hand.
when you
Gently
put
rotate
this,
the catheter
that
with the
controls
thumb
the
and
suction.
index finger of the sterile gloved
wish we had
hand
the
as the
room
catheter
going
is being
here.
withdrawn. Do not allow suctioning to continue for more than 10
Okay.
seconds.
All right, what does she say about, you don't suck when you're going down, because you could push stuff down into the bronchus.
Do not occlude the Y
So-
port when inserting the
So
catheter.
that's the Y port. So you put it in,
Apply intermittent
So
suction
many
by
inches.
occluding the Y port with the thumb of the unsterile gloved hand.
sometimes you have
Gently
to,
rotate the catheter with the thumb and index finger of the sterile gloved hand as the catheter is being
main
withdrawn.
thing is don't
Do not
touch
allow
the chest.
suctioning to continue for more than 10 seconds. Encourage the patient to cough
then
and
you
deep
can
breathe between suctioning.
Put you some stuff here.
Okay, Mr. Jones, if you'll just
Okay.
cough that mucus up, I'll be
Alright,
able to
y'all wanna-
suction
y'all
it
wanna
out
try
for
it?
you. I'm gonna give you a little bit of time to rest, okay? Catch your breath.
Let's not order enough
What
to-
questions do you have on this?
And according to
Mine's
the patient's
ju- I guess
tolerance
just
of
the-
procedure.
Because I know she
Allow
has
the
sterile
patient
gloves that
to
she's
rest.
putting on, and she's just using one as the non-sterile.
Okay, let's go over this from start to finish, okay? All right. You come in, you identify your patient, okay? You got in the order, so you know what you gotta do there, okay? You talk to him, you gather your supplies, it's always the same routine, just like the video says. And I think this was,
Did y'all have the thing in there?
Mm-hmm. You didn't have it?
No.
I
That's
think-
why I was confused. I was asking Miss Paula. I was like, "What is that?" Because I don't have
yeah.
that.
Just remember, the reason why it's sterile was, you're going down into the respiratory tree. Of all places, you don't want to introduce bacteria down into your bronchus, okay? So, you know, like, this was like, I don't know where it was in the pack, or if you had this separate, but this right here, I don't see any reason once you get your, and remember too, before you put your gloves on, you need to get your suction hooked up, turned on, ready
Okay.
to go.
Yeah, that's
Before you put
a
your
better
gloves on.
idea.
So come in, identify your patient, go get your supplies. First thing I do, I turn it up to 20-30.
Okay.
Okay, I've explained everything to him, okay? I open up my gloves, and that pack, I don't remember where she put it. You know, I poured my saline, I put my mask on, I already checked my lung sounds. You notice how she checked them here, here, she went down here and then over here. She had, you know, let's say he had, you could hear him rattling, okay? So you do all that, okay? Just remember, you don't suction for more than about, what,
10 seconds.
10 seconds, okay? And then if you get clumps of stuff, you need to irrigate it out through there. Sometimes if you have to get a specimen, you have to get what we call a Lukey trap, L-U-K-I, for bronchial secretions, and they'll send it off for CNS in the lab. Okay, so when you put it in, are you on the suction?
No.
No. You put it in, what, 10 to
10 seconds.
10 to 12 inches?
Oh, 4 to 5
centimeters.
inches.
Four-
4 to 5 inches.
4 to 5 inches, okay? And then as you're coming out,
You
Keep rotating it
you
with your thumb
rotate
and your
it. Yeah,
foot.
because it may be, you know, you think of your bronchus, you know, like an asthmatic like me, it's very narrow, so you might have trouble. It might be like down to there. So what you're trying to do is you rotate, you're trying to get all around the wall of the bronchus, okay? And then sometimes they will spit and sputter. That's why you need face mask, you know, the protective eyewear. And we have some of that.
That
Or
shield.
goggles or shields, eye shields, and then your mask.
Okay.
Because you don't know what he's got. He might
Right.
have TB, he might have some other kind of bug.
Yeah.
So,
I was able to watch a suction once, and the guy had me stand behind the bed because
Yeah.
because I wasn't all
yeah.
messed up. But he
Yeah.
said stand behind the patient, and that way you don't
Yeah.
have to worry about it. But
Let me say this, if it's somebody that's really, really bad, really gunky, okay, I would wear a yellow gown.
really, yeah,
I'm gonna be taking care of other people all day long, and I don't want all that stuff on me.
yeah,
Because it's just like when we're dealing in orthopedics with bone fragments and stuff, that stuff is spraying everywhere.
yeah.
And I don't want all that mess on my clothes all day long.
I think I'd want a shower before I go home in some of those cases.
Well, I tell you, some of them are, always look at your diagnosis, what they're being treated for. How long have they been on antibiotics? Have they had a history of TB? Or what else? Are they AIDS? All right? Be
Yeah.
very careful. And if need be, you can always double glove.
Yeah.
All right? Nobody tells you can't wear 2 pairs.
Too bad there's not like a body glove
In
though.
other words, you protect yourself.
Okay.
Okay. Anything else?
We're
But
done
really,
with Trach.
this is not real.